Tēnā koutou katoa. Welcome everyone to our professional forum. And the webinar today is being presented by Nick Dowling. A lot of you will know Nick. Nick is the nurse coordinator of PDRP in Southland, based in Southland. And just a little bit about Nick. She's been involved in Southland's professional development and recognition program, PDRP, for more than 20 years. So we have a very expert person talking to us today. She's worked through the various changes over the years in nursing council, nursing practice and continuing competence requirements as they underpin PDRP. And this year in particular, 2025, has seen significant changes for enrolled and registered nurses within the scopes, changes to scope, introduction of new standards of competence, and changes to continuing competence requirements. And having a good understanding of these, says Nick, of these requirements and processes supports PDRP. And I think all of us are pretty interested. It's kind of watch the space a bit at the moment, which I'm sure Nick will go into. It's happening gradually. We have some of the key things out there already, but the changes are going to be gradual. And we welcome and thank you very much today, Nick, for talking to us about these. Kia ora.
Kia ora, Lorraine, and kia ora koutou, everyone, and thank you for the opportunity to talk today. I'll just share my screen. So my presentation today is just really looking at the revised scopes and the new standards of competence for registered and enrolled nurses. And I guess today's a very timely day to do it, since the new continuing competence requirements have been brought in as of today. So the main thing that I thought I would do today is just actually talk about what the changes are. And for that, I'm actually going to use Nursing Council's resources. So many of you may be familiar with the PowerPoints, the frequently asked questions documents, and all the other supporting resources that Nursing Council have sent out and also posted on their website. So I think it's important for that to maintain consistency of the information initially. So I will be utilising Nursing Council's resources. And, for this purpose, that's what I'm going to be talking about, is Nursing Council's changes initially. Then look a bit about Whatu from here, and then follow in with the impact of this on PDRP, or what this means for PDRP going forward. So, of course, my position in this talk is that I am the nurse coordinator for PDRP. And, therefore, council requirements and standards of competence are part and parcel of our role. I just also want to acknowledge that I am tauiwi. So, when it comes to talking about te tiriti, kawa whakaruruhau,
I wonder if if Nicola has frozen. Yikes. Sorry everyone, I think Nick might have frozen there. I'll just give her a call. So we just have a quick pause. Thank you. sorry, everyone, we're trying to get hold of Nick. I think she might have dropped out, but I've got Julie Simons on the case. So she's zooming down to let her know. So that's great. So sorry, we'll just have a quick pause there and give Nick a chance to come back online. Thanks.
Hi Lorraine, I'm back. Sorry.
Not at all.
I completely lost all Wi-Fi, so I've had to go and quickly jump on a different computer.
Okay.
Yeah.
I'm not too sure where you were up to, Nick, but I realised you'd frozen a little bit, quite close to the beginning, I'm afraid.
My apologies to that.
That's quite all right. Thanks, Julie. So you were just talking about, you were going to go through, essentially stick to the council slides and talk about that.
Yeah, sorry about that.
No problem.
Right, I'll just share my screen again.
Okay. Everybody's
Apologies, everyone.
living there. So yeah, lovely. Thanks, Nick.
No worries, sorry for that. Just quickly,
No
you can never log on quickly when you need to do as a hurry. Righty-ho, so what I was saying is, yes, I'm going to use Nursing Council's resources. So as the slides go through, where you see Nursing Council's logo or banner at the bottom, they're actually council slides. So let's get into it. So I guess when we're looking at why the changes, if you think about when our scope of practice for the registered nurse was last looked at, that was back in 2015, which, 10 years ago, think about the changes in nursing practice over that time. And for the enrolled nurse, is 2012. And then, of course, the competencies fell in afterwards. So if we think about the context of practice back at those times into the shift of nowadays, it definitely was the time to look at, where nursing's at, what practice was at, and those, key pieces of legislation and standards around supporting our practice underneath it. So one of the major concepts that you'll see that's been included in the new scopes, or the revised scopes and the new standards of competence, is very much the integration of te tiriti within everything nursing. And Council has their te tiriti o Waitangi policy that was released back in August 2023 that actually really clearly outlines what Council's stance is around, having te tiriti as a primary document within nursing and how it can be utilised to, have equitable health outcomes for Maori within there. And also underpinning that commitment to the te tiriti is to the use of te reo. So, and as we go through the changes, the revised scopes and the new standards of competence, we'll see kupu included within the language being used. And of course, we're very familiar already with the term po, that's, which is, describing the sections, if you like, within our standards of competence. So, a place to start, when we're looking at these new documents, is actually just getting familiar with the terminology that's been utilised within it. Council sees that integration of te tiriti is very, very powerful for nursing and very powerful for protecting health and improving health outcomes. So just in general, do we need to undertake any additional education? Well, I think the first place to start is actually to really get familiar with what the documents are, read the scopes for both the enrolled nurse and the registered nurse and have a look at the changes within it, the language that's been used, and also the concepts that have been included in with it. Also to the standards of competence documents, look at the POs and the differing descriptors under each PO and what that means for practice. And I think if, in the first instance, if we look in that and reflect on, what we know, where we're at, and actually where we could actually learn a bit more, that would give us a good place to start looking at that. Also too, as I've mentioned, familiarise ourselves with the kupu that's used within the document to actually understand what they means when we're reading of it. And yes, we're definitely going to be assessed differently for continuing competence under these new standards of competence. And Nursing Council have actually already posted their new competence assessment forms for the enrolled and registered nurses up on their website today. So you'll be able to see to what the continuing competence requirements are, and certainly the recertification audit documents going forward now from current council, and you can find them on the recertification page of Nursing Council's website. So changes taken effect. So we've seen the revised scopes came in January, and of course today's the day where continuing competence revalidation audit starts. So nurses from today, when it comes their time to renew their APC, the quarter that their birthday's in, should they be lucky or unlucky enough to be audited, that will be against these new standards of competence. Now, of course, you do have the option to still undertake PDRP instead of audit, but the audit requirements from today on are against the new standards of competence. And then between now and the 1st of January next year, all other programs come into play with the new standards, and that of course includes PDRP. So as a program, we have until the 1st of January next year to align our programs with the new standards. So let's have a wee look at the registered nurse scope and standards of competence. So the major shifts that we've seen with the scope is, as already mentioned, the integration of te tiriti within it, and also to kaua whakaruruhau. So looking at cultural safety very much from the Maori context within there, and also to a separate po around cultural safety. So when we go to look at these scopes, we'll see that that's very much interwoven, that then follows into the standards of competence. The other inclusion too is the development of differential diagnosis. So of course, patients are more complex, nursing practice has changed, there's and also to the depth and breadth of nursing, and the different roles, models of care being utilised out there for nursing has enabled the development of practice, and also the inclusion of differential diagnoses within there. And there's also some further information on that as we go. Whakapapa-centred care is another new concept that's been incorporated into the scope. So that's just looking at, ancestry, things that actually impact on well-being and patient care, not just from the here and now, but also to, whether from a positive or a negative aspect, things that can impact on patients' health. And there's another wee blurb as we go forward looking at that. So we know that the registered nurse is no longer responsible for directing and delegating to an enrolled nurse, but we are responsible for supporting and guiding enrolled nurses in practice. And of course, the scope informs the development of our new standards of competence. Some common kupu that's been included within the scope and standards, of course, we'll be familiar with the word po already, but when we look at the sort of the meaning around those words, it actually gives a greater context to what it actually means. And if you think of for instance, the number of po, the 6 for the registered nurse and the 5 for the enrolled nurse, those are what holds up and are the foundations for our practice. So they all link together and come together when we're looking at our nursing practice and providing care in whatever aspect that is. And you'll see, a number of other familiar terms within there, but also to language that's going to describe the po as we go forward and look at that. But, it's really, really sort of good to understand the context of those kupu within the standards of competence, within the scope, and what it is actually articulating, because they're not a direct translation of the word that they sit beside. When we come and look at the standards of competence later, they have their own meaning on their own. So the registered nurse scope, so of course you'll see in that first paragraph is very much about te tiriti and cultural safety. We move on to the next one that's, very, very clear that, our practice is consistent with our education assessed competence and relative legislation requirements, and that's very clearly put within the scope, and also to the emphasis of this revised scope and the new standards of competence, as it is very much, this is where you're at, this is, what you can and can't do, and this is where you're at to whatever it is you do. And I think that's too will be quite significant for the enrolled nurses. The third paragraph there is that inclusion of that differential diagnoses, and then just moving on to the responsibility of our care and what we're doing, and of course support and guidance to enrolled nurses, but our direction and delegation is to other members of the healthcare team, for example, healthcare assistants. So just a bit more around kawa whakaruho, and this is very much within the Maori context, that safety being respected and understood without that fear of discrimination, and all throughout. When we're looking at continuing competence, it's very much a reflective process for us to have a look and think about, what is our practice, what are our values, what are our biases, and what does this mean for us to help us learn and grow within our practice. And then when we're looking at whakapapa-centred care, it is very much looking at, our connections to family and ancestors around their well-being. So, that could be drawing on past experiences, our background, our values that, again, can either have, a positive or a negative context that goes on to then, impact on our well-being. And then, of course, how we're delivering our care. The frequently asked questions documents that Nursing Council have put out to support the scopes and the standards of competence also have some really good information around what this means within practice as well. So I highly recommend reading those. So direction and delegation is already mentioned. It has definitely changed. Direction and delegation's gone. It's the support and guidance that registered nurses are now providing to enrolled nurses. And throughout, when Council talks about direction and delegation and the changes in scope, it's very much emphasised it is about teamwork, working together, and how that looks, and that ability to communicate professionally as well. Differential diagnoses, so just again some further information on what does differential diagnoses mean within the scope. So it's very much about, it isn't a definitive diagnosis, it's about interpreting assessments, interpreting findings, those sorts of things, to actually coming up with this is what we think is going on here, and having a plan of care as well, but also to talking about it from the interprofessional healthcare team, and actually that is part of the wider team that then goes on to potentially inform a definitive diagnosis from the primary clinician. Of course, we're not expecting all nurses to be able to make a differential diagnosis, and it is acknowledged that it is a continuum, and some may and some won't. It'll be more relevant to some roles than others, of course, and just again, it's back to that education, experience, and assessed competence around those sorts of things. So the PO for the registered nurse is for PO 1 and 2. They're exactly the same for the registered nurse and the enrolled nurse standards of competence. When we come to PO 3 and PO 4, whanaranutanga and pukengatanga, they're very much similar between the similar concepts between the registered nurse and the enrolled nurse, and then for manakitanga and rangatiratanga, they're very different between the RN and EN scope. So it's quite good to have a look at the standards of competence side by side to actually get more of a clearer picture around what the registered nurse looks like and what the enrolled nurse looks like. So we have the 6 PO, and then under each PO are a number of descriptors that give us more information or actually guide us to articulating our practice in regards to the PO. So when it comes to Maori health, that's when we're looking at things like the utilisation of te reo and their descriptors around ongoing professional development around te tiriti, kaua whakaruruhau, cultural safety, and incorporating that within our practice. When we're looking at cultural safety, it's very much, cultural safety as defined by the patient, if you like. So it's not what we think is culturally safe, but how do we know that the care we're providing is culturally safe? And then, of course, going on and looking at making sure we've got an inclusive workplace going from there. Communication, whanaungatanga, looking at communication with patients, whānau, and across that sort of aspects, but also to our interprofessional healthcare there. So again, looking at how it is that we communicate. It could be the verbally or non-verbal communication, digital records, those sorts of things. Pukengatanga is looking about our practice, nursing assessments, planning, differential diagnosis, and evaluation of care. And it's back to the evidence-informed nursing practice. It's very much talking about that scientific knowledge and that evidence that we use to make our decisions and critically think. So manaakitanga, our patient-centeredness, that's all about, our communication, our therapeutic relationships, those sorts of things. So that trust and understanding and compassion. And then rangatiratanga, the leadership, it's not, about leading an area or being a leader within it. If you look further down within the, what that PO means, it's about, being a change agent, speaking out, intervening and advocating concerns. So, that's when it's, really, really good to, look really into what the PO means and the descriptors around it, because, the term leadership could be perceived as not as it is intended in the first instance. And, previously for nurses in non-clinical roles like policy, education, research and management, we've had supplementary competencies for the domains 2 and 3. So now we don't have that anymore. Nurses, regardless of their roles, their areas of practice, should be able, can evidence their practice against the 6 PO. So, when we're looking at that, there will be something in there that applies to every nurse's practice and the context within their work. And that, so again, if you're in those long clinical roles, it's really, really good, again, just to have a look and look through those descriptors and think about how your practice relates to the PO using those descriptors to guide. So just moving on to the enrolled nurse scope. The major shifts for the enrolled nurse scope is, again, the inclusion of te tiriti, kaua whakaruruhau, and cultural safety, but also to, and I think probably one of the most important points is the scope has been expanded, the potential for the enrolled nurses in practice. So actually, we've seen the shift in the RN practice, and so again, we're seeing the shift in the EN practice and the potential for the enrolled nurses and the contribution they make to the healthcare team. So there is that greater breadth of practice, and it is very much determined by education, assessed competence and experience, just as it has been from the enrolled nurse. But also too, that direction and delegation has been removed from the enrolled nurse scope. And again, it's about the enrolled nurse seeking support and guidance for the registered nurse or other healthcare professional as the need arises. Again, looking at the kupu that's, within the enrolled nurse scope and standards, similar terminology again, but with the addition of manu, mana Whatu, which relates to PO 5 for the enrolled nurse scope. And again, it's just looking at, you know, the words and what do they mean within the context. So the enrolled nurse scope very much, you know, outlines in a similar way to the registered nurse scope, again looking at te tiriti and cultural safety within the first aspect. You know, practice is consistent with education, assessed competence and legislation, as we've seen, but also too then goes into further about talking about how the enrolled nurse works in practice, and again seeking the appropriate guidance should they need from a registered nurse or another healthcare practitioner, which is of course a practitioner that's under the HPCA Act. Direction and delegation has changed, so we know that the enrolled nurses practice in accordance to the education, assessed competence and experience, and I think that's, you know, a really, really important point to remember is that, you know, often it's, you know, when I've said to people, what do you think the enrolled nurse scope's about now, what's changed, and it's that, oh, I can give IVs now. Well, you know, that's organisational policy. We take it back to, you know, what is the education preparation, what's your experience around this, are you competent to do the task that's been given? So it's thinking back to that broader concept and actually, you know, individual for the nurse as well. So, you know, and enrolled nurses have the ability now to work in leadership roles and other roles, you know, again, based on the education, competence and the experience. So very much the enrolled nurse scope is opened up, you know, and, you know, opportunities for the enrolled nurse, and you can see there that, you know, enrolled nurses can provide direction and coordination as you would see potentially in a leadership or a coordination role. And again, Nursing Council just emphasises that communication and that teamwork is the key to practice there. So for the enrolled nurse, we have the 5 PO, and again, just, you know, like we talked about for the registered nurse scope, when we look at PO 1 and 2, word for word exactly the same, because, you know, te tiriti doesn't change whether, you know, you're an enrolled nurse or a registered nurse. PO 3 and 4 have similar titles, but of course, you know, go into the different aspects, and then PO 5 is very much separate. Again, and like anything, there's the number of descriptors that sit underneath each PO that guide our practice around what the PO means and where we are on the continuum around that. So we've already looked at PO 1 and 2 and what they mean for the registered nurse scope. Excuse me. PO 3 for Nangatanga is that partnership and communication. So effectively, you know, working within the greater healthcare context and how the enrolled nurse communicates within that. Knowledge-informed practice, so the difference there, even though we're still utilising the kupu pukingatanga, is very much around knowledge-informed practice for the enrolled nurse, and looking at, you know, their clinical knowledge and expertise around the nursing care delivery there. And mana Whatu, that professional accountability, and that's when we're looking at things like code of conduct and other aspects that impact on our responsibilities within nursing practice. So as mentioned, there's the opportunity now for enrolled nurses to be in non-clinical roles, and so that's, you know, practice is not now restricted for direct patient care. And, you know, there is that ability to work in roles like leadership, management, and those sorts of things. So, again, it's, you know, the enrolled nurses are accountable for their own practice, and there is that ability to open the door to a wider breadth of opportunity for the enrolled nurse. Nursing Council, so what does that mean for continuing competence and of course recertification audit? Nursing Council's got this great document that's on their website as well that provides really, really clear guidance around, you you know, when we're signing our APCs each year, we're saying we're meeting the requirements for continuing competence. And of course, should we get audited, these are the things that we have to evidence or provide evidence to Nursing Council around. So as of today, those that are audited going forward self-declare that they've completed 450 hours of practice over the last 3 years or 36 months. Again, like we've done previously, we're required to have 60 hours of professional development over the last 3 years, and that should be made up of professional development activities, not completely all mandatory education, and of course relevant to the scope and context of where you're working. A new thing that they've did here is it should be linked to the PO. So if you look at Council's new documents, they'll have their new audit documents, they'll have, you know, an area where you can write your professional development activities, you know, date, what the activity was, how long it was for, and then what PO it relates to or what POs it relates to. So that's just a case of PO 1, PO 3, that sort of thing. But that's just something to think about, you know, moving forward for those educational professional development activities that you undertake is, you know, it may be worthwhile just noting the PO that that activity relates to then, rather than trying to backtrack and pull it at a later date. There is no longer the requirement of providing, you know, 3 reflections on professional development or a statement for each activity, so that's been removed. So practice hours and professional development hours are a self-declaration. They do not have to be verified as we've done previously with, you know, letters from employments or, you know, Employee Connect printouts, those sorts of things. The self-assessment now needs to be against the PO, so you still need to do a self-assessment and provide examples, an example or examples of your practice relating to each PO, and that's, so there'll be 6 that you'll provide, or 5 for the enrolled nurse, and you use the descriptors under each PO to guide your examples of practice around that. So it may be that you're including 1 or 2, or it may be you're including 3 or 4 to guide what it is you're saying, but it's relevant to your role, and you do not need to include all descriptors within there, but they're utilised to guide, you know, just what you're evidencing under that PO. It's very, very clear going forward that, you know, AI is not to be utilised to generate our examples of practice, and there's some further reference information around the documentation as to why. You know, our reflections are, our self-assessment are reflections, and, you know, AI is not to be utilised for that. And when we're signing our declaration, we're also signing to, there has not been, AI has not been used in the process. And then the last thing is the verification declaration that basically just attests that the examples of practice given within the self-assessment is true to the nurse's practice. So in the first instance, it should be the senior nurse, a senior nurse manager, but it's acknowledged for those, you know, workplaces that potentially there is only one nurse within that organisation. It could be, you know, it may not be a nurse that signs that, it would be the employer or the manager. So have a wee look at that document, because it's a really good guidance around what is the requirements for continuing competence, what is audit requirements, and then of course when we look to PDRP further on, that's what PDRP will be based on when it's changed. And the reasons for that is because PDRP is a recertification program under the legislation or under the HPCA Act. So, you know, that's why you'll see these, and you've seen previously, audit or continuing competence requirements as a baseline to PDRP. But certainly go on and have a look at Nursing Council's website and the new documents on there, and that'll give you a clearer picture of these requirements just in that document format, and they actually look quite good. So where to from here? How long's a piece of string? I guess you know, the first thing that I would highly encourage is to become familiar with the scopes and standards, and just not for your scope of practice, but for both, because it's really important to see just actually the changes and the differences between the scopes, and what the requirements are for us and others, and how that looks, similarities and differences, so you can get more of an understanding on what they are. I'd encourage you to reflect on those and identify your own learning needs, and that may be looking at some professional development activities around Te Tiriti, Māori health, cultural safety, or it may be going to look at a more clinical focus to help around differential diagnoses. It could be even going back to policy and procedure, for instance, around medication management, which has now been incorporated into the descriptors. So, there is a lot going on in there and a lot to be learned. And certainly, every time I read them, I identify new things that, I think, I better remember that and look into a bit more. And then, of course, as an organisation, depending on where you work, does your current documentation incorporate the Nursing Council competency? So do they need to be moved forward to now look at how the standards of competence fits within it? So, it's just, just having a bit of a stock take is where are we now and where potentially are we needing to go? And, certainly from a Health New Zealand Southern point of view, those things are underway. So PDRP, so I guess just, back to where we're going, Nursing Council continuing competence or audit requirements is a process in itself. So whilst we've got all these changes happening for Nursing Council, we've got to remember that that is separate to PDRP. While they are interwoven, there is two separate processes happening. So from a PDRP point of view, or Te Kahui Kaukarimatanga, which is a regional PDRP or a South Island PDRP that we work with, at the moment, the only change that you'll see going forward, which has happened today as well, is the removal of the peer review and the incorporation of an attestation statement. So just to clarify what that means is for PDRP submissions from today on, don't need a peer review. So you can basically put a line through that requirement. But what you will need is that attestation statement from the senior nurse, manager, whoever, saying that the examples of practice provided in the self-assessment is a true reflection of the nurse's practice. And if you look back to the audit or the continuing competence requirements, that verification was a requirement there. So that's why it's been pulled over into here. And that is separate to the manager endorsement that we currently have in PDRP. So PDRP is staying based on the old, well, I guess they're the old Nursing Council competencies and domains going forward. And the reason being for that is, in order for PDRP to change, we need a national framework to change. So a national framework is what guides PDRPs at what says what our levels of practice are, what says what needs to be included in each portfolio submission. So that needs to be completely rewritten to now be in line with Nursing Council's continuing competence requirements, and then what levels of practice will look like going forward. So that is expected as a draft in about August. Then, of course, once that's completed, we'll need to change our programs and then have Nursing Council approve our programs, because we are a recertification program. So it may be towards the end of the year before you see, the changes completed within PDRP, which we have to the 1st of January to do. So it's really important to just be clear that they are going to be sort of separated for the meantime, but will come back together by the end of the year. So, if you are non-PDRP, you're going down the standards of competence pathway and just completely follow, Nursing Council audit requirements. For PDRP, we're going to be in change over the next, how many months towards the end of the year. So it's just to be really, really clear on which process you are doing. And then, of course, we have organisational appraisals within the middle of it that has their own requirements as well. So if you're unsure on which process it is or what the requirements for each process, please ask, because, we do recognise that it will be confusing going forward, but it's just to be really, really clear, there is a PDRP process and an audit process that will be different before they come back to being the same. But you can still choose to do either should you be audited. But of course, PDRPs on the old competencies, audits on the new standards of competence. Hopefully that hasn't confused the last bit, but we do recognise that it is going to be like that going forward. So thank you for listening. There's a list of all the reference documents that Nursing Council has got on their website. I haven't added in their 2 new competence assessment forms there yet, but you can see there is a lot of information out there, and sometimes it's just pulling it together in one place just to make it manageable in the first instance. And apologise for my Zoom going down and losing that time and being a bit more speedier with my presentation. And of course I left my notes at my last desk that I was at. So thank you for your time, and appreciate your patience in that presentation.
Thank you so much, Nicola. It didn't show that you left your notes at the other desk. Excuse me. And I can't wait for it to be gorgeous at the end. That'll be great.
Yeah.
But ka motiwehi, that was ngā mihi nui, that was brilliant. And I think you give very good advice, and absolutely look at the documents. But I found you going through them, even though I've looked at them a few times, was really helpful just to hear someone talking about them at the same time.
Yeah.
And also side by side comparing what the old scope was and the new scope and that sort of thing is useful advice. You gave us a comprehensive walkthrough, which was excellent. Does anybody have any questions? There's nothing in the chat there. I think really everybody and groups and colleagues need to basically just get on with it, don't we, really, and just familiarise ourselves with them, and maybe organisationally identify what we think might be some training or some support that we need in order to come up to speed with some of the changes. So they might be conversations going on in the future. But I might actually get you back. Sorry, Nick, I was just going to say I might get you back maybe towards the end of the year or something to have an update.
Yeah, that'll
Sorry,
be cool.
what were you going to say?
I was just going to mention that if you've seen the latest pānui that Nursing Council have set out, they've set up webinars once a week, which are actually going to take nurses through these changes as well. It's a very much condensed version. They had their first one yesterday. It's a half an hour of some information and some question time. So it's not, it's not an extensive presentation, but it's just a really good snapshot overview. And it's basically most Mondays for 6 weeks, half an hour, 4:30 or 2:30 in the afternoon. So just, go back to that latest pānui and have a look. But
if you don't mind sending me that pānui, I don't know how to miss that, and I'll also get it circulated.
Yeah, and so it's just on, if you go onto Nursing Council's website under the tab News, it's listed under there, but it's just another good reference place, sometimes just to, again, hear it over and over again.
Sounds great. Just a couple of comments here, a comment and a question. Sharon Feist says, excellent presentation and advice. Chat is disabled, but we're getting to you through the question and answer function, so that's good. Thanks, Sharon. Edsel is saying, for annual appraisals of staff who do not wish to submit a PDRP at this stage, would you recommend to use the new framework or the old framework?
Yeah, and I can answer that. So Edsel, at the moment, there has been a working group together looking at some new focus on use going forward that'll support the new standards of competence, and the performance appraisal framework will actually give you clear guidance around that. So going forward, for nurses not doing PDRP, definitely the new framework, and there should be some documentation out in the next few weeks to support that. So yep, get familiar with the new stuff.
Right. Yep, that's been going on in the background, so that's lovely. I think that's everyone, Nick. And the important thing to say that I forgot at the beginning is that Nick's presentation has been recorded. supposed to tell people that at the beginning. Whoops. And then we circulate a link. So anybody who's missed it, they can look at it later and listen to Nick talking about the new documents. And I guess another thing is to keep an eye, quite a constant eye on Nursing Council website at the moment, because there's new stuff coming up all the time, isn't there?
Yeah, definitely. I mean, they've put some amazing references out, so certainly commend Nursing Council how they've transitioned to this. I mean, there's a lot to get through, but they are very, very good.
Yeah, it's great. And I think in the next little while they're looking at cultural safety updating and code of conduct. So
Yes,
it's going to be
there's a
ongoing.
lot happening, yeah, over the next year, and the NP and prescribing as well. So yeah.
So we'll try and keep up to date in this forum anyway. So lovely. Thank you so much, Nick, Ngā mihi nui, and kia ora everyone. And thank you for joining, and particularly thank you to you, Nick, for making a complex lot of things sound doable at least. Thank you.
Thank you.
Bye.
Bye.